Do you know that osteoarthritis is one of the most common form of arthritis affecting millions of people worldwide? But what exactly is it, and how does it affect our body? Let's break it down. Today, our topic is osteoarthritis, why your joint hurt, and how to fix. First, come to the point: healthy joint versus osteoarthritic joint. Here we find a picture that demonstrates a normal joint and an osteoarthritic knee joint. That is the normal joint. We see that is the normal structure, that is the normal space between the joint. But in the osteoarthritic joint, there is some degeneration and the joint space massively diminish, and the two bones comes very closer to each other. So, healthy joint versus osteoarthritic joint. Joints are where two bones meet, as the knee joint as hip joint. Where the two bones meet, there the two bones meet and helps to move the parts or helps to move the body. And healthy joints have cartilage, and the cartilage is a cushioning material that helps the joints to move easily. And in osteoarthritic joint, the cartilage begins to wear over time, and in the osteoarthritic joint, the cartilage begins to wear over time. As a result, the easiness becomes diminished. As the cartilage breaks down, bones start rubbing each other, and the pain begins to start. And it causes the pain, swelling, and stiffness. As the bones begin to rubbing, they create pain, they create swelling, and subsequently stiffness experienced by the patient. And as like gears grinding together without lubrication. Without lubrication, the lubrication is diminished as a result of osteoarthritis, and the two surfaces of bone rubbing together. And sometimes the patient feel very tough pain. And now come to the point: factors contributing to osteoarthritis. Age is the biggest one. Age is the biggest one here, biggest one factor here. Our cartilage losses strength over time. Naturally, our cartilage losses strength as our age become older, and also triggered by joint injuries, obesity, and even genetics. Sometimes genetics create early wear and tear of the joint or cartilage, and obesity is another factor. Due to obesity, that is overweight, the patient the joints are experience overweight, and as a result the joints begin to early wear and tear. And what is the symptoms of osteoarthritis? What is the symptoms of osteoarthritic joint? The symptoms is mainly pain, stiffness, and swelling. These are the pain specifically after movement or in the moving. That is the patient feels pain when they begin to move, or sometimes they feel pain in the morning. That is, osteoarthritic patient will feel pain in the movement and they feel pain in the morning time. As the condition progresses, range of motion of the joint may get limited, and simple tasks like walking or climbing stairs become very challenging. The range of motion, that is the movement pattern becomes stiffened and painful, and in the advanced level for that patient, there is some simple tasks like walking and climbing, stairing become very challenging for him or her. Now we can come here. That is the what can it be changed? The good news is managing osteoarthritis is possible. That is the very good news. The managing osteoarthritis is possible, and regular exercise, maintain healthy weight, eating anti-inflammatory food helps reduce pain and increase mobility. That is, the healthy lifestyle is very important here. The person should be encouraged in regular exercise, regular taking healthy diet, taking anti-inflammatory foods, and this helps him to become healthy and helps the joint become healthy. As a result, he will be able to throw challenge to the osteoarthritis. And people also find relief through physical therapy. That is, the physical therapy is very important option to relieve pain due to osteoarthritis, and pain medications also sometimes helps them. But painkiller for long time is greatly injurious for the patient. It may create a very much problem to his liver, his heart, or other structures. And also joint injection also helpful here, and here is a great emphasis on physical therapy, because physical therapy is the procedure that encourages natural healing for the patient. So effective exercise and effective physiotherapy and right physiotherapy is very important to relief from the osteoarthritic symptoms. And sometimes the surgery, joint replacement is an option when the osteoarthritis goes in an advanced level. The surgery can be a solution for the patient. And while osteoarthritis might challenge the way to move, it doesn't mean you stop moving. With right care, you can keep enjoying and stay active for years. That is, your healthy lifestyle, healthy behavior is very important here. So, do you learn something new today? We hope you learned something new today, and it will be effective for you. And this program is for your benefit and your family benefit also. If you like, please share it to your friends. Hope to see you soon. Bye.